and we are talking about intrusive thoughts treatment for OCD. Really, truly have never seen more kids with OCD than I have sort of in this pandemic world. So let's talk about what OCD is. What are treatments to help with intrusive thoughts? And as I said, it's something people struggle with, and intrusive thoughts can be part of anxiety. But what really is OCD, right? So, OCD is all about the fear. Everything a person does of any age who has OCD is to prevent the bad thing from happening. Hope that's an aha moment. And how is OCD different from anxiety? They are definitely different. Like I said, they're cousins. Um, OCD used to be part of anxiety disorders, but it's its own thing now in the Diagnostic and Statistical Manual. And with OCD, you have everything you do is to prevent the bad thing from happening. You're having intrusive thoughts and rituals. You're spending an hour or more a day. And they tend to be totally irrational, even though it could have started with something real. Where anxiety is a pervasive worry and it's a clinical issue as well. You're not doing everything to avoid the bad thing from happening. You're worrying. So, and it tends to be more real, right? Like I had a bad grade, so I'm afraid I'm going to get the bad grade again. Where OCD, the person may have never had a bad grade, but yet they're totally worried they're going to get bad grades. So that's important. So how does OCD form a habit in the brain? Most people don't know about OCD, and you might be here because you might be worried your child has OCD or you have OCD. So it forms what's called a negative reinforcement cycle. And this habit starts because you have this, behavior, right? So I'm going to avoid um, my mom's chicken soup because I think all chicken soup has germs in it. And if I eat it, then my dog's going to die. This is what happens in OCD. It doesn't make any sense, right? And so every time they avoid the chicken soup and the dog doesn't die, right? They have some anxiety, they avoid it, and they get reinforced because the dog didn't die because it's all irrational, right? So the brain forms this association, and the more the person is allowed to avoid, whether they do it or the people around it accommodate it, the more it's going to form a habit in the brain. You're probably like, holy cow, Dr. Roseanne. Like my poor parents that come to me, you're realizing all of these ways that the sneaky OCD gets in, right? So how do we turn this around, right? Well, number one, we have to calm the OCD brain. This is critical. This is what I talk a lot about in my Thought Tamer kit. If you want to go to drroseanne.com/OCD kit, and dive into it, right? And there's a lot of things we can do to calm our brain. We can get magnesium, get our multi-mag brain formula. You can go to drroseanne.com, magnesium. We can do mindfulness work. We can do breath work. We can do neurofeedback. We can do PEMF. Again, I dive all into this in the Thought Tamer kit. But got to calm that brain, right? I have a trademark program called Brain Behavior Reset for a reason. Brain behavior. So we've got to calm the brain, help that brain to self-regulate, and we have to change behavior. So how do you do that? What can you do to turn those intrusive thoughts around? And that's a question that a lot of people come and work with us one-on-one. And when you have OCD and you're really looking to change behaviors, you need an OCD specialist and a licensed therapist. Really important. And you can't just go to any therapist because they might throw some, just some techniques. Yeah, I know how to work with OCD, but they really aren't an expert in it. And there's a difference between expert care. Whenever somebody's like, oh, I can do neurofeedback in my town. Well, go ahead. What you're doing when you work with me is you're getting 30 years of experience. And expert care means we've done due diligence to really go deep in something so you get the benefit of it. When you talk to somebody who's an OCD expert, you're like, wow, and it moves the dial, right? You're going to an anxiety therapist who does a great job with anxiety, but you just learned anxiety and OCD aren't the same and the treatment isn't the same. So let's talk about ERP therapy techniques for intrusive thoughts. So ERP is exposure response and prevention. It's a sort of the gold standard of therapies for OCD. What is it? How does it work? So it actually combines cognitive behavioral therapy, where you're learning to think differently, right, about your thoughts, and you're changing your behaviors, but it adds a different piece. And the E stands for exposure. So you're adding safe exposure. So with proper treatment, you are learning to the if you don't do the bad thing, if you don't do the thing that you think the bad thing's going to happen, it's not going to happen. So you teach the brain that in the case of the chicken noodle soup, now we never start with the biggest thing, right? This is all done with the care of a very seasoned person. I think you're starting to understand how important experience is. Because a lot of times people come to us because they went to somebody who took a course and they started them on, the highest worry. That's just going to freak you out. You have to be very strategic, and there is a hierarchy list that really helps to dismantle the bigger ones by addressing the smaller ones first, because the brain then knows success. So what are some techniques that you can do as a parent, right? Again, it's in our thought tamer kit. You can go to drroseanne.com/OCD. We have lots of tips and resources and ways to calm the brain and address behaviors. But the number one thing a parent can do is, if they have a child with OCD, is not feed the barking dog. And that means don't feed the OCD monster. And so it's so easy, right? Like, oh, I'm just not going to make chicken soup. We're feeding the worry, right? So when your child, and this is a real story that just happened the other day and happens all the time, so I'm not sharing anything private, but I had somebody who came to me and they were like, I think I'm listening to your show. And I didn't tell you that I thought he had OCD, because I thought it was anxiety and I didn't know what it was. And I now realize he's got us doing this whole bedtime ritual thing. And they explained it, and I was like, sounds like some OCD is at least a kindling here, right? Because a very young child and it hadn't been going on a terrible amount of time. But when the parents don't perform the ritual, he won't go to sleep, massive hysteria. And they were like, so we just perform the ritual. I mean, even his little brother is part of the ritual. And if we don't do it, he won't go to sleep. And I was like, well, that's how OCD starts. So you have to reinforce their tolerance, their coping skills. Now, again, you can't hit the big things. So let's say that your kid had a bedtime ritual, right? How can we address that, right? Let's back it up and say, we're going to bed. We're not going to participate. We are going to do it this way, X, Y, and Z. And you want to help to reinforce that, the bad thing's not going to happen, and you're not going to give them too much support, right? So you want to teach stress tolerance. You let them know there's only a certain amount of time they'll be uncomfortable. And then you want to reinforce the heck out of them for tolerating uncomfortableness, right? Never go after anything huge. Start with little things. And I think this makes sense for anybody that has a child or a teenager with OCD. They might ask you questions. They might try to take you down a path that's sort of related. And you always want to reinforce a coping skill. Like, wow, that must have been hard for you. How did you do that? Oh, I really loved how you talk back to that OCD. Is that your OCD brain, or is that Josh's brain? You want to get in there and get that support for yourself. And you want to know that what is the right thing I can say, because man, OCD is a beast and it forms habits really quickly. So I hope this was really helpful for you. And I hope that you got some information. I love talking about OCD because most people feel like it's an albatross that they're going to have for the rest of their lives. And that's just because pharma wants you on meds. When you calm the brain and you come in with behavioral strategies, wow, you can turn it around. So if you're looking more support, I created this unbelievable resource for you. People have to work one-on-one with me to get it. Go to drroseanne.com/OCD, but you can get it today.